moving to the human resources of the department. For 2021, the DOH allocated 16.58 billion for human resources for health, or HRH deployment program. This is a 66% increase from the current year's allocation for the same program. Okay din. Pero based on the budget brief from the Committee on Finance through our LBRMO, 23,364 healthcare workers will be deployed to different healthcare facilities. Will this deployment cover the entire country?
Yes, Mr. President.
All right. What particular healthcare workers will be deployed? Doctors, nurses, midwives, ano ba?
So, Mr. President, it includes physicians, nurses, midwives, dentists, medtechs, pharmacists, nutritionists, dietitians, physical therapists, and public health associates.
Okay. Are these HRH still to be hired healthcare workforce, or are they already existing healthcare workers currently employed by the agency? So out of the 23,000, I'm sorry, I overheard the answer of the secretary. I'll let the sponsor answer it first for the record.
Oh, it's already been filled up. Teka. Ano ba yung 2023 bago or from 2020 pa yun? Kasi ba't sa 2020 note nakalagay 90%?
Ilan ang existing dito sa 23,364? Yun na lang. Yun na.
Mr. President, most of them, over 90%, have already been hired now. But syempre po, merong magre-resign, so papalitan. So this is just continuing budget for that staffing requirement.
Oh, so that the number is the target. Ano?
Yes,
The number,
yes.
okay. What is their status? Yung mga current at saka yung ipapasok pa, what is the status of their employment? Permanent o temporary?
Mr. President, PS po sila, pero ang status nila is temporary, renewable every year.
Renewable every year. But this has been existing since 2019, di ba? So, kailan ba ito nagsimula? Di ba 2019? Okay.
2019.
So, if this is going to be recurring, why make their employment and deployment? Why not make it permanent? Employment and deployment. So that we will have enough health workers in all our healthcare systems. Anyway, we're allocating budget for them anyway, yearly. Might as well make them permanent.
Mr. President, because we have a devolved healthcare system, officially, it is the LGUs that are responsible for hiring itong mga primary care
Healthcare
personnel.
workers.
However, it is also the job of the national government to augment when needed. And obviously, they have seen the need, and that's why they have these positions that are being filled. However, because the local government code assigns the implementation of health primary health to the local, in due time, it's really supposed to be the local health officials who will hire them. Now, I'm the one adding this, perhaps with the Mandana's ruling, they will now have more funds because yun naman yung problema ng local. We know that, no, that
Bayad.
they cannot hire anymore. So perhaps with the additional income, the over 1 trillion that they will collectively receive, they can allocate, maybe there would be guidelines that would say that healthcare has to be a priority, something like that. That's just my own personal opinion, Mr. President.
All right. I'm not sure if you're one of the authors, but I know Senator Bongo is the author, and the Medical Reserve Corps.
I am, Mr. President.
You are, no? The principal author.
I wrote my own bill on that, Mr.
Yeah,
President.
that's good. Will this reinforce the HRH deployment program?
I will answer on my own, but I will also ask the secretary. When I drafted that, Mr. President, it was really, the objective really was to have this reserve force that can immediately be counted on and be, I don't know if drafted is the right word, called to action as needed. So whether their deployment would be 1 month, let's say it's a typhoon, no? Baka naman po in 1 month, okay na sila. Pero something like this pandemic, baka for 1 whole year or beyond, they would be deployed there. So the answer is yes. The DOH would have to determine the length of time and the details of their how they implement their jobs, Mr. President. But yes, the answer is yes.
Okay, very good. We should fast track that bill. Now, under the HRH deployment program is the scholarship grants by the DOH. No? According to the budget brief that we browsed through, DOH has a provision of 3,492 scholarship grants. May I know how many are allotted for the medical scholars?
Same ba? Same. Mr. President, based on our files with LBRMO, for 2021, 1,837 scholars for the course, the medicine program, and that amount is 469,188,000, Mr. President.
Did the DOH already considered the provisions of the Doctor Para sa Bayan Act, particularly in the scholarship program?
Ito ba yun?
Yes?
Is this the implementation? Actually, kasi Mr. President, if I look at the previous year, 2020, it was 1,357. So there's an increase of 500. So is that implementation? Opo daw, it already takes into consideration the Doctor Para sa Bayan, Mr. President.
Okay. Yung previous ninyo, yung DOH scholarship program dati, how many doctors have already graduated from that? From the time you started it up to now?
Mr. President, the number I have is that those who graduated in 2020 and are due for the return service is 156 for the medical
156.
program. 156.
All right. How many?
Combination? It actually says 2019 and 2020, so it seems 2 school years po yun.
So my next question would probably be all, because I wanted to ask how many of these scholars are still working for government up to now.
How many
I hope all of them.
are they? Mr. President, they are all in the Doctors to the Barrios program.
All right, very
That's what
good.
I'm told. Yes.
Thank you for that. Now, for 2021, there will be a merger of 2 line items in the General Appropriations Bill. The National Immunization and the Family Health, Nutrition, and Responsible Parenting. The new line item, I understand.
President,
Oh, yes.
with his honor's permission, can I just spread into the record a concern on my own concern on this medical scholarships before
Yeah.
his honor moves?
Please do
So
so.
that it's consistent.